Okay, let us start with genetics. Genetics is also a very important topic. You get a lot of questions based on genetics. Okay, so let us start. Starting with a question. Um, okay, so just a second. Okay, starting with the question. Let us. Okay, revealing the answer in five, four, three, two, one. Okay, so your answer is 1 raised to 2. Let's see what the question says. So the parents of two children would like to try for another child. Their first child, Adam, was diagnosed with cystic fibrosis, and their second child, Z, is healthy. Both the parents are asymptomatic. What is the chance of their next child being a carrier? Okay, so now I would like to highlight this point. Like Dr. Adam and Dr. Z are really good friends. Dr. Z is uh, the creator and the mastermind behind Blavable, and Dr. Adam is also one of the masterminds behind Big Mox. So I'm also volunteering to help in the 2024 January Blavable course. So I would suggest that go for that course as well. It is gold standard for your exams. So this is one of the questions that Dr. Z had created. So I took it from him. Um, so this is showing a situation regarding cystic fibrosis. All right. So the first child was diagnosed with cystic fibrosis and the second child is healthy. Now both the parents being asymptomatic, what is the chance of the next child being a carrier? Now in this situation, we will see that both parents are asymptomatic. That means this can be a condition that both parents can be carriers as well. All right, and as you know, autosomal recessive conditions, you should uh, learn all the autosomal recessive conditions. Like cystic fibrosis is an autosomal recessive condition, sickle cell anemia, thalassemia, congenital adrenal hyperplasia, hemochromatosis. So these are the kinds of diseases or the disorders that are um, autosomal recessive conditions. So you have to make a list of autosomal recessive, autosomal dominant conditions, and most of the times just expect that the question won't be mentioning you about whether it being the exact thing like autosomal recessive. They won't mention it. They would just give you the name of the disease. So you should know what this condition is. Okay, let us see how this thing is done. Okay, so this might be a bit difficult for some of you to understand. So let us show you how it is done by making a Punnett square. Okay. So considering father, considering father being a carrier, denoting capital A and small a. So small a is the disease gene and the capital A is the normal gene. And mother is also a carrier. Okay. Now crossing them here. So this is the kind of situation that you get. Okay. So here, what is the question asking us? Let us see. The question is asking us, what are the chances of the next child being a carrier? Okay. So simply we've done the cross matching and we got two children. They can be carriers out of the four children. Okay. So this is a normal child, this is a normal child. Just this is a normal child and this is a normal child. Only these two children are carriers. So this is not a normal child, sorry. This is the diseased child, right? This is the diseased child. This is a normal child, and these two are also normal, symptomatically normal, but these are carriers. So they have asked us what is the probability of the next child being a carrier. So the thing is like two out of four children can be carriers. So this is your probability, two out of four. If you do the fractions, it comes out to be 1 raised to 2. So this is your answer. So when you come across these kinds of questions, just make a Punnett square. Okay, every time make a Punnett square. This is not a Punnett square. This is how I learned genetics. So this makes it easy for me to solve by doing a cross matching. What you can do is, if you are comfortable with the Punnett square, just make a quick Punnett square for you for your own comfort. All right. Any question of genetics, make a Punnett square. That's a pro tip. Coming to the next question. Okay, X-linked recessive condition. Now, coming here, what are the situations that come across in an X-linked recessive condition? Okay, so X-linked recessive. Sorry. Okay, in case of X-linked recessive, if the mother is a carrier, now always remember the defective gene will always be on the X chromosome. Now, showing you a situation. Genetics is really simple. You just should know how to make a Punnett square or a cross matching. All right. So I'll show you how I've learned things. I am really bad at making a Punnett square. If you are good at Punnett square, do that. But what the way I've learned is by making cross matching. Okay. So the father is healthy, relatively healthy, so unaffected. And mother is a carrier, so she has one X chromosome which is completely normal, and the other X chromosome has the X-linked recessive disease. So this is the diseased X chromosome. All right, so this is your mother is a carrier. Okay, mother is a carrier. Now, going through the cross matching, what do we get here? We get a female, completely healthy female. We get a diseased male, and we get a normal male, and we get a carrier female. All right. So this is a condition that you come across while when you are seeing a situation of X-linked recessive disease. Okay. Now, there are certain situations where they can ask you, what is the probability of a female child being carrier? So it would be 1 raised to 4. Or what is the probability of, sorry, a female child being a carrier will be 1 raised to 2, because there are only two female children, right? So out of them, one is a carrier and one is normal. And in this situation, what is the probability of a male child being affected? So you have 1 raised to 2 again, because there are only two male childs, right? Now, in case of X-linked recessive, I would like you to remember that females are never acquiring the disease. Okay, females never acquire the disease. Okay, in case of X-linked recessive condition, female never acquires a disease, because in order for female to acquire a disease, the father should be affected and the mother should be a carrier. So in that case, you would get a female child having both the affected X chromosomes, right? But male child can be affected very easily in case of X-linked recessive condition. All right, whereas you would very commonly see a carrier female, but a disease female for X-linked recessive condition is very rare. I had also explained this fact in our hematology. Um, right, I had explained it in hematology lecture as well, where I was differentiating between von Willebrand disease and hemophilia. Right, so hemophilia is an X-linked recessive condition. So it is very, even DMD is an X-linked recessive condition. You won't have a female diseased patient. You would always have a male person who is acquiring the disease from the mother. All right, and also male can never acquire an X-linked recessive disease from the father, because male receives the X chromosome from the mother. Male only receives Y chromosome from the father. Okay, I hope this is clear now. Coming to the next question, I'll give you 1 minute to solve this question. Okay, revealing the answer in 5, 4, 3, 2, 1. And your answer is B, 25%. Okay, so what does the question tell us? A 3-year-old child has been diagnosed with DMD, Dugeen's muscular dystrophy. His mother is now pregnant with her second child. Okay, there is no family history of disease besides the 3-year-old child who is affected. Okay, she wishes to know the chances of her second child also being affected. What is the likelihood of a second child having DMD? Now, here they haven't mentioned the The gender of the patient, the sex has not been mentioned, but you have to assume that it has to be a male child, right? So, sorry, okay, just a second. Here, the gender is not revealed. So, DMD is an X-linked recessive condition, of course. So, in this situation, the first child is already deceased. Now, what is the likelihood of the second child having X-linked recessive condition? So, your answer is 25. Now, coming back to this table, so you have to find out the probability of a diseased child. Okay, so since they have not mentioned the gender of the patient, so you just have to see the probability of the diseased child, and you know that since the mother is the carrier and father is unaffected, because the first child was affected. Okay, so in this situation, mother is always considered a carrier, father is unaffected. And what will be your probability of the child being affected, second child being affected? It is 1 out of 4. So 1 raised to 4. That comes out to be 25%. Okay. Just remember this condition. Okay. This is very basic. You have to make a Punnett square or a cross match, whatever works for you. For all the questions, you have to make it. Then it comes out to be very easy. This is one different condition where child's gender has been mentioned. So let us see what the question is asking us. A 3-year-old child has been diagnosed with DMD. Now the mother is pregnant. It's the same question, but here the second child is a male child. Okay, now they've mentioned the gender. What is the likelihood of second child suffering from DMD? Now, same question here, they've mentioned the gender, which is male, so we are only concerned with this part of the Punnett square or the cross matching. Okay, only this part we are concerned. So out of the two male children, one is diseased and other is non-diseased, so your answer comes out to be 1 raised to 2. The probability of the second child contacting a disease will be 1 raised to 2, so which comes out to be 50%. I hope this is clear now. If you have any doubt, you can ask me anytime, but the best way is to practice more and more of questions. Then only you can understand how things are working. Okay, and make the Punnett square, make the cross matching for every question. Okay, this is the same thing that I drew for you, X-linked recessive disease. Okay, now this is a homework for you guys. Okay, this is a question. Um, let us see who can make a Punnett square and send it on the WhatsApp group. Okay, send it on the WhatsApp group, or you can DM me personally. You can send me personally also. Um, just take 2 minutes for this question. Okay, and send me a pedigree diagram, or even after the lecture, take a screenshot of this question and send me a pedigree after the lecture. Okay, pedigree diagram after the lecture. I hope everyone took the screenshot. Okay, those who must be interested took a screenshot. It's better to make a pedigree diagram after the lecture and send me personally, and I'll review it for you guys. Okay, let us move forward. Okay, so continuation of that question, the answer is A. Okay, for you to remember the question that you took a screenshot of, the answer is A. Okay, but your homework is to make a pedigree diagram or a cross matching or a Punnett square. Okay, and DM me personally. Now, things that you should know about BRCA. Okay, BRCA gene positivity, or these come in the question. Okay, BRCA mode of inheritance, autosomal dominant, and family history of few men with prostate and breast cancer, BRCA2 gene mutation. Okay, just remember that. One more very popular question. I took this from GEMS. Okay, this is a very important topic. We usually neglect it, but there can be 2 or 3 questions based on this. Okay, investigating potential genetic diseases. So before pregnancy, if a patient comes before pregnancy, wants to know about the genetic diseases that the patient is suffering from, so what we will do is we will uh, we will advise the patient to go for a pre-implantation genetic diagnosis. Okay, which is called as PGD. And if the patient comes in relatively like first trimester, week of 11 to 14 of pregnancy, and at that time we would we would do a chorionic villus sampling, okay? And relatively towards the second trimester in week 15 to 18, just remember these weeks of pregnancy, okay? From 11 to 14, we do CVS, which is chronic villus sampling. From 15 to 18 of pregnancy, we do an amniocentosis in order to investigate for a potential genetic disease, okay? Remember this slide. Now, the difference between chorionic villus sampling and amniocentosis and chorionic villus sampling, there's a very good mnemonic for you guys to remember. CVS is earlier than amniocentosis. How is it that? Just remember, cable TVs used to come before Amazon Prime, right? So, cable TV is your CVS, which is done earlier, preferably in the first trimester, 14 to 11 to 14 weeks of pregnancy. And later came the Amazon Prime, which is your amniocentosis, done in the second trimester. That is your 15 to 18 weeks of pregnancy. Okay, I hope this is clear.